Bismillahirrahmanirrahim. Assalamu alaikum. Today the drug which is to be discussed by me is Captopril. So starting with the introduction of Captopril, Captopril is actually first antihypertensive drug which is used to treat high blood pressure and heart failure. It belongs to the class of drugs ACE inhibitors. Now, what it does is that it decreases certain chemicals that tighten the blood vessels so blood flows more smoothly and the heart can pump blood more efficiently. Now, next is the Captopril Origin. Basically, there is a peptide in the Venom from Bothrops jararaca snake, which is a poisonous snake and is responsible for lowering the blood pressure. So, this Venom is used in the preparation of Captopril. Moving on towards the history of Captopril. Captopril was developed in 1975 by three researchers whose names were John Vane, Kevin KF, and Sergio Ferreira. Now, what is the chemistry of Captopril? Captopril is a solid white to off-white crystalline powder with the slight sulfurous odor, and its molecular formula is C9H15NO3S. And lastly, it is a L-proline derivative. Moving on towards the pharmacokinetics. Now, what is pharmacokinetics? Pharmacokinetics can be described with the help of four letters, which is ADME: absorption, distribution, metabolism, and elimination. Firstly, absorption. Captopril is rapidly absorbed in GIT after oral administration, and if there is food in the GIT, then of course the absorption will be reduced. The peak plasma concentration of Captopril is 1 hour, as I have attached the graph here as well. Next is distribution. Captopril is distributed to most of the tissues except CNS. The bar chart here shows the progress, discharge, and worsening of Captopril. Lastly, metabolism and elimination or excretion. Captopril is actually metabolized in liver, but it is eliminated through urine. And in the 95% of the absorbed dose, which is eliminated through urine, contain 40 to 50% of unchanged drug, and the rest of them are inactive disulfide metabolites, captopril disulfide and captopril cysteine disulfide. Now the main thing, which is the mechanism of action. Here I have drawn a picture which shows the mechanism of action of captopril. Let me explain it. First of all, when there is low blood pressure in the body, renin is released from kidneys. Now, renin causes the release of angiotensinogen from liver, which is an inactive compound. Angiotensinogen is converted into active compound angiotensin 1. Angiotensin 1 converts into angiotensin 2. Now, here angiotensin 2 performs two tasks. Firstly, it goes towards the adrenal gland and release aldosterone, which causes the increased sodium and water retention in the body, and blood pressure is increased. Secondly, it causes vasoconstriction and decreased glomerular filtration rate, and in turn decreased urine output, which cause increased blood pressure. Now, when we give ACE inhibitors, or specifically we are talking about Captopril, the Captopril does not allow angiotensin 1 to convert into angiotensin 2. When angiotensin 2 is not formed, aldosterone will not be released, and sodium and water retention in the body will decrease, which will allow the blood pressure to decrease. Secondly, it causes vasodilation by going into blood and binding to the 82 receptors of blood. Of course, this will cause the increased urine output, and blood pressure will be decreased. Now, the clinical pharmacology of Captopril. Captopril is given in basically four conditions, which I have mentioned here. Firstly, hypertension. When optimal conventional therapies are not working in a patient with hypertension, then they are given Captopril, which allows 20 to 25% of the blood pressure to normalize. But some patients, along with Captopril, require diuretics or beta-R blockers. Secondly, Captopril is given in congestive heart failure along with diuretics, digitalis, or beta blockers. Thirdly, it is given in myocardial infarction in the form of short-term treatment or long-term treatment. Both these treatments are given in clinically stable patients, but long-term treatment is given as a result of asymptomatic left ventricle dysfunction. Lastly, diabetic nephropathy. It is the condition in the patients which have diabetes type 2 disease and also the impaired renal function. So, captopril can also be given in such patients. Next is the side effects of captopril: cough, angioedema, some pregnancy problems, taste change, rash, fatigue, proteinuria, renal insufficiency, increased potassium, low blood pressure, bronchoconstriction, vasodilation, etc. Contraindication. Certain contraindications are present, due to which in specific conditions captopril is not given, like in the presence of any allergy to any of the ACE inhibitors it is not given. Secondly, during pregnancy it is not given because it has serious side effects in fetus, and also it's not given during lactation because it decreases the milk production and affect the neonate. Let's talk about the dose of captopril. According to the condition, the captopril dose is adjusted. Firstly, hypertension, maximum 450 milligram daily can be given in two doses, like a morning and evening dose. Secondly, congestive heart failure is a case in which 25 to 150 mg can be given 3 times a day. In myocardial infarction, about 50 mg 3 times a day can be given, and in diabetic nephropathy, 25 mg can be given 3 times a day. Next is the toxicology of captopril. We normally say that if dose of captopril exceeds 450 mg per day, it is the toxic dose, and it can cause hyperkalemia and hypotension in the patients. Now, what is the treatment? Naloxone is an opioid antagonist which is considered as the antidote of captopril, and it blocks or reverses the action of captopril. Next is interaction of captopril with other drugs. There are several drugs which show a negative interaction with captopril. If given with the captopril, it shows the risk of angioedema. Diuretics can decrease blood pressure. Potassium and potassium-based salts can increase the blood potassium level. Pain drugs along with captopril can decrease kidney function. Sirolimus, which is a drug which is used to prevent organ transplant rejection, can cause severe allergic reactions. And lastly, high blood pressure drugs like losartan and valsartan, along with the captopril, can cause low blood pressure, increased potassium levels, and kidney problems. Lastly, there are some brands of captopril which are Vesotone, Captoglo, Captril. Moreover, they are Lopril, Tensobon, Capoten, Cespelon, Allopresin, Esipril, and many more. That's all from my side. Thank you much.